Welcome to Oncology Unscripted. My name is Matt Spraker, a radiation oncologist in Denver, Colorado.
My name is Katie Coleman. I am a kidney cancer patient and patient advocate in Austin, Texas.
And my name is Julie Johnson, and I am a sarcoma patient and patient advocate in St. Louis, Missouri.
We're teaming up to meet in the middle for a candid and educational podcast about cancer that is intended for patients, doctors, and their teams. This show and our opinions are meant for general informational purposes and are not medical advice. We encourage you to reach out to your doctors to discuss your individual case. Thanks for listening. Now let's get on with the show. Anyway, so I wanted to put this one up. I think I suggested this topic, or it's been suggested in the past, and I may be motivated doing it, mainly because of my own family. I went with my wife to pick a doctor, and I thought that we did a good job of it this time, and the appointment went excellently. And so it got me thinking a lot about how to pick your doctor. And as part of prepping for this, I'll just say I went back and listened to the Second Opinions episode, which is probably loosely related to this topic, but it's actually not the same question, because there we talked a lot about you have a doctor and now you might want to go get another opinion from a different one. This is like, how do you pick the one that you're going to work with for your cancer treatment? And so I made a little outline, and maybe I can just drive a discussion here and then we'll just go through it. The first thing that I wanted to bring up is that, I had this question, is your doctor given to you or do you pick it? And it's actually probably worth talking about, because I think in the Second Opinion episode, we talked a little bit about timing and making sure that we don't let choosing a doctor hinder the ability to get started with treatment quickly, which sometimes can be important in the cancer world. And so I actually thought about how a lot of patients are actually given a doctor because you're diagnosed, for example, and then you are given a referral or an appointment with an oncologist. Is that your perception as well? And have you thought at all about that? Or do you have any comments about how a lot of people are actually given one? And then now we're going to be talking about how they pick it. I don't know if it's...
I do, just from a, I don't know, I have two kind of thoughts here. One, as a patient, and I think we've talked about this before, of how crazy it is that patients are making the most important decisions in their care at a time period where they know the least about their disease. I know I probably wouldn't have had enough information to know how to pick a doctor when I was initially diagnosed, but at the same time, I wasn't necessarily given a choice or education about the choice. I might have had a choice from all the doctors that existed, but all that I knew about them was their names. I didn't know what areas they specialized in, other than just a general, oh, they all do X. And I can share a little bit more in a story about that later, as I'm sure we'll get into more details on picking a doctor. But to me, it's always felt like you were given a doctor in cancer. When I think of any other specialty, primary care or anything like that, I feel like I'm picking my doctor because I feel like I'm the one who's actively going to do those things. Whereas with cancer, I felt like I was more given a doctor.
Yeah, that's a really good point, actually. And I think that that's something that's probably just worth saying. And I actually found a couple of resources I'll link to where people have written how you should pick your doctor. And they're really kind of talking about a primary care doctor, or at least it's implied they are, because you're right that if you are screening or doing something that's not urgent or, quote, elective, and what I mean is just you're choosing to do that as opposed to something happening to you, it's different than if you are given a cancer diagnosis and then linked up with a team. It's a great point.
Yeah, from my perspective, I was given a doctor. And even as I think back to my Second Opinion visits, in many of those cases, not all, but the majority, I was also given a physician when I called the center. You call a center as a patient and you're calling kind of a scheduler. And that scheduler is just placing you with a physician. And there were a number of times where I asked for a specific physician, and I never got it in any of the circumstances where I actually asked for it. Actually, there was one time I did get the physician I asked for.
I've helped a couple patients navigate that exact scenario pretty recently, of newly diagnosed patients with a specific type of cancer that wanted to see a specialist for that type of cancer, and they knew that they were at a specific institution, and they did the thing. And it sounds like, Julie, you did the same thing that I did, of like, I just called the center and just hoped that I'd land at the place that I was supposed to by telling them information about my case. In my case, I didn't. So I called the general, like, MD Anderson line. I said, I have a really rare cancer. I didn't know the name of the doctor that I wanted to be with, but I knew who, because I had seen videos and presentations and webinars and stuff from him, to know that he was a doctor that studied rare kidney cancers. And so I was giving that context to the scheduler over the phone. And I remember also in support groups getting advice of like, you want to see a specialist. I think, Julie, I saw you mention that coming across in things as well. And so I said that to the scheduler as well, like, I want to see an RCC specialist. And the scheduler on the phone told me they're all GU specialists, so they're all RCC. They can all see kidney cancer. And while that statement's true, like, a GU oncologist is more specialized in kidney cancer than just a general oncologist that you might get at a community center, they also all have their little areas of niche and expertise, which is not necessarily filtered out by the scheduler. So when I didn't know that information as a newly diagnosed patient, I didn't know to push a little harder and ask for somebody a little bit more specialized, as well as I was so worried about getting in quickly. I think we talked about this in the second opinion episode of like, I thought I had to get in right away or my cancer was just going to go crazy. And so when I said, can I get in for an appointment as soon as possible? I mean, the scheduler's job is to find you a space on the scheduler, right?
Yes.
So
Yeah.
it would have been more beneficial for my long-term outcome to be with a specialist. They're going to filter that view and information on, let me get you in with whoever can see you soonest. I'm sure the rest of the details we'll figure out later, which, as we both know, switching when you're already within an institution is quite difficult, and all those details don't necessarily work themselves out later.
Yeah.
There's one thing that Julie and I were actually talking about that I think this is where we will get to a place where we can maybe give some advice on how to pick your doctor, what we think about. But one thing we were talking about that's more of just a commentary on the way things are set up in the United States medical system is really this concept of like are you picking your doctor or are you picking the center, right? And if you go back to our second opinion episode, which I think we should keep talking about because people should definitely go listen, thought it was really good. We talk a lot about picking your doctor as if you're picking the center, right? I'm going to MD Anderson. I'm not going to Dr. Smith and MD Anderson, right? And so I think what's really interesting is that actually reflects a big change in medicine that is unique and people like I think is important culturally for how we approach this. One thing that's definitely happened is that, you know, if you think about medicine and oncology and cancer care, like everyone has this idyllic vision of this doctor that's like the hometown doctor that's like your oncologist in town. He might come to your house and treat your cancer. That's maybe how it was like in 1920, 1930. And then for better, for worse, medicine has just changed substantially since then, right? There's very few like guys that have a practice in a town where it's like Dr. Smith's office and you go there and you get cancer care there. Nowadays, it's much, much more common for Dr. Smith to go work for MD Anderson, for example, right? And so there's been this corporatization where like these small solo practices really just don't exist. And if you look at the statistics of how this is changing nationally, it's a huge trend. And you can talk about good or bad things about that, but it's funny because I feel like we're in this place where there's almost as many people that are talking about picking their center versus their doctor, and they're happy to just take whatever doctor at that center that's in the group that treats them, and that versus like seeking out a specific doctor, which you still see, like you both just talked about, but maybe a little less commonly. The only other thing I would say is that you mentioned before where you want a doctor with specific expertise because they're the best or they're going to give me the best care. We'll talk about that in a minute. But I would say that like experts that talk about quality, so things that like if you're asking the question, where am I going to get just the care that makes me have the best outcome or the highest quality care? There's a growing acceptance that this is less and less dependent on a single doctor. If you go like nerd out and dive deep into the government quality stuff where they're talking about Medicare and how to regulate these things, like there's a big push to recognizing that the team really matters. And so if you're a patient with a rare cancer, your outcome certainly could be dependent on Dr. Smith and his or her specific expertise. But we think that what really matters is not just Dr. Smith, but also Dr. Smith's nurses, the specialists that might work with them to manage your case. You both, Julie and Katie, have had treatments from multiple different types of doctors that all come together to go to your outcome. And so I think it's really hard for patients to navigate how this is all shifting and recognizing that it is teams that matter a lot, even though culturally we think about this, doctor up on a pedestal in a white coat with like light shining down on them from the sky, that kind of thing.
I think and I think we should also preface that like Julie and I are going to be coming at this from a rare cancer perspective. Like when I'm thinking of centers or I'm thinking of doctors, like sure, if I had a common cancer, there's probably still like knowing the space a little bit more. Like there's specific doctors I would go to just because I know like these ones are up to date on the most stuff always. They know their stuff. But I'd be much more inclined to pick the center because of the scenario you just described. Like I know that center is going to have a comprehensive team that can handle whatever I have come up. And I know it's common enough that everybody will be educated enough about this thing to help make the best decisions for me. And so in those cases, I'm choosing a center and care less about the doctor. Not that I don't care about the doctor, but it's not as high of a priority for me. But being a rare cancer patient, I would actually like, I completely agree with what you said. It's a team thing. Like, I accredit a lot of my care to a team and a team of doctors. However, to me, it's also the one doctor. Like, I mean, not necessarily in my case, I've got several of the one doctors, but it's the point person to coordinate that care and finding the right point person who's going to advocate for you to get the right people and the right care team around you um, is very, very different. Like that, there could be all the best nurses and all the best things at, for example, like a community center for me. But if I don't have a doctor that specializes in that one thing, I'm not going to get routed to the right people for my care. So yeah, I don't know if I have an exact way to describe that, but I'd be curious, Julie, if you feel similarly about that at all.
I do. Yes, I do. I mean, I think when I think back to my own situation, I'm really choosing a doctor based on who I think is going to who is in position to connect me with the right people or treatments to get me the best outcome that I can get. And for me, that is it's a both. It's the center and it's the physician, right? It's the center having the resources, having the access, having the trials, and it's the doctor having a certain mentality, bedside manner, personality, whatever you want to call it. So yeah, I mean, I think it's both of those factors matter. If I was going to pick a different center or different physician, I would be thinking about both of those things.
I'd be curious to get your opinion, Julie, and your thoughts around this, because this is something that I thought about so I polled on social media what would be important for people, and I might be jumping ahead in our outline here of choosing their doctor. And I found it very interesting and insightful the different types of answers I got depending on if that person had a cancer diagnosis or not. And very similarly related to me of like a lot of people who didn't have a cancer diagnosis said things like, I want a doctor that listens to me, that believes me, that's willing to explore options with me, look into things. Like it was all around being heard and validated, which I completely relate to, especially like for how much I had to fight for my diagnosis. But then patients that had a cancer diagnosis, it was more around, I want them to know their stuff. I want them to be specialized. A lot of them was like, I want them to have empathy and care, like understand their situation, which I get to, but I don't know, it'd be interesting to get your perspective on. I'd be curious if you feel similarly on that, Julie, as far as like being a rare cancer patient. I do care about like the empathy from my physicians can make all the difference in the world. And those things matter and have an impact. But at the end of the day, like I'm also trying to stay alive. So the things like I could totally take somebody who had a terrible bedside manner if they really knew their stuff. Like I wouldn't want to, but if I knew that they were the best, like having a rare cancer, I think I would tolerate that more than if I had all kinds of options to choose from and they're all going to give me the same treatment. I'm going to go with the ones that are a little bit more empathetic and
Yeah.
make me feel better.
I agree. And it was interesting. I also polled, um, but I didn't poll anyone who didn't have cancer. I actually just polled within some of the cancer groups that I belong to. And in both instances, I posted this poll in two different groups. I worded it the exact same way. Um, Center reputation and ranking was the number one factor that people used when needing to pick a physician. And then behind that were attributes associated with a reputation that the physician, a professional reputation that the physician has, or a reputation for having or specializing in the type of cancer that this person had. Um, I was really shocked to see that, like, I worded it two different ways. I worded it once as the physician's professional reputation, and then I worded it separately as the physician's personality or bedside manner. And that one did not get a lot of votes. People were more concerned with their professional reputation. And I think that speaks a little bit to what you just talked about, which is I can handle a jerk if he or she is going to save my life. Like I can deal with that. Preferably, like I don't really want to, but I can. That can be a temporary inconvenience that I deal with as long as this person delivers.
Yeah, I think it's very interesting because I think it also changes, right? Like I think of like different prognoses I've had at different
Yeah.
times. And like if I had a non-curative prognosis, and this is a long-term relationship with my like oncologist, for example, just trying to keep me alive as long as possible. Yes, I want whatever options are going to be available in their education in that goes a long way. But also, that is where like quality of life and bedside manner matters a little bit more to me because then I'm battling things like how do I navigate life while I'm on treatment and like the words and the things that the physicians say in those appointments can have significant bearing on your life and kind of what happens in that period of time. So it's such a complex thing to think about. And I think one thing to point out is that like you don't have to be like tied to that position forever as well too. Like if you decide that you want maybe your personality or your goals or your priorities somehow change or pivot, like also acknowledging that it's perfectly okay to go for a second opinion, like at a different point when you need something different from your care, even if something was working for you previously.
Yeah, and I'll also add, I think almost all of the physicians that I saw when I went for second opinions basically invited me back if I needed another opinion later down the road. So, I when I think of it's interesting when I think about who my team is right now, like there are people that I would reach out to if I had a recurrence. Um, that I haven't like that I had a second opinion from years ago, if that makes sense. But I don't, I don't see them for scans or anything like that. I get monitored somewhere. But I still consider these people to be part of a team that I could tap into if I needed.
Yeah, 100%. Like I agree for like I'm being seen by MD Anderson and the NIH, for example. I technically probably only need to be followed by one of them if I really wanted to, probably would be the NIH since I'm like in their protocols. Um, but at the same time, like if I ever got to a point where I was like just like scanning or surveillance and I didn't need a second opinion all the time, like my oncologist might be somebody that I might not see as often, but if I had a reoccurrence or anything, it'd be an instant go-to. Like you said, like they're kind of people there that you know. I think I was thinking about this really recently, actually, because I had the bladder mass that came up for me. I recently had a bladder mass removed. Thankfully, it was benign. But like my oncologist was one of the first people that I reached out to for that, even though it was like not exactly bladder. Like we weren't sure if, I mean, it was pretty rare that it'd be a metastases, but like I had confidence that I'd be connected with the right people. But I was thinking about how like I went 9 months not really knowing what this thing was. Like everybody didn't think that it was cancer. Everybody externally seemed to think it was, which was like, as a patient, kind of hard because you're like playing defense of like trying to explain why we're not biopsying it and trying to like validate all of the recommendations that came from my physicians to all these external people constantly. And people like, I feel like I handled that way better than I did earlier, like when I was initially diagnosed. Obviously, very different situations, but I was thinking about like what was the difference that really made that different for me and that whole experience different for me. And I think it's because like I already had established relationships. I had confidence in my teams and I knew even if they weren't the experts, I knew how to get to the experts and I knew how to look for the experts. And so that alone provided so much like reassurance that I didn't have initially in my diagnosis. And I think that's what, when I think of people who are newly diagnosed, like, I think that is like such a tough place to be. And I really wish more centers and like more physicians were transparent about what their expertise is, what their niche is, and all those kinds of things to really help patients be able to find that so that they could feel more of that reassurance earlier on in the process.
I think that's a really great point. You actually both, I have a second point written down here of like what are you trying to achieve? Like because I felt it was a little unfair. I mean, I sort of asked the question as generally as possible because I think it's great to hear what comes out of it. But I think just to say like how do you pick your doctor, listening to you both, like you kind of use a different strategy at different points in your care based on what you're trying to do, right? Or what you're trying to achieve with that question. And so like I think with the last what you just said, you were kind of talking about picking your doctor to do a procedure. Is that right? I mean, because that with the bladder mass, that's sort of what you were sort of explaining.
Yeah. And I went to three different places until I found the right fit.
So you actually had three different consultations with different, I also say proceduralists. 'Cause I don't know what kind of doctor they specifically were, but they did that procedure and you were picking among the three, like for the person to do a procedure that you knew you needed, right? Is that kind
Yeah.
of
Yeah. I had a local opinion who also like advised like you're a special case, you probably should be going to the cancer centers. So then I went to MD Anderson and I went to NIH. And I got a recommendation to a doctor at MD Anderson and I didn't quite like the treatment plan or it wasn't the provider that I had been currently seeing, but I didn't know if that was the right treatment plan. I didn't feel completely comfortable with it. So I went and got another opinion at the NIH, and then I felt more confident in that opinion and those specialists and stuff like that. I still think that the other doctor I saw is an incredible doctor. And so I think that like that's something that's always worth pointing out is like it's doesn't mean that the other person isn't qualified enough. Exactly. It speaks to exactly what you just said of like, I just had different goals and different priorities. And so I picked the one that matched with mine.
Yeah, and I think what's funny is like, and I think somebody made the point where like this might even change as you go through treatment and kind of priorities change and things like that. And so I actually would say that one thing we could do as physicians to make it easier is what you said in that initial consultation, for example, because. Just taking a quick step back, like if someone gets diagnosed with cancer, like they're not really like said, people don't say to them, okay, you have cancer, like go find the doctor you want, like good luck. No one really like does that. You get connected with a team and a doctor because it is important that we get started with treatment at a pretty decent pace and we don't like drag things out. So I think one thing that, for example, I could do, I'm often that doctor where I just see the person because they've been diagnosed. I'm in the community. I have a big team that's busy and we see people. I could explain to them, explain the timing. We talked this a little about this in the second opinion episode, where if things are urgent, like it's not on the patient to kind of know that the doctor should be able to tell you, like, do I have time to seek out other opinions? And then to explain the components of what we're doing right now so patients have a clear sense of what the questions we're asking at the moment, right? If someone's just diagnosed, you're asking questions about treatment. You're not really asking questions about doing scans for surveillance at that point in their care. And so I think being more like, I guess for physicians that are listening, just being more direct about what the goals are, the short-term goals they're trying to achieve in that visit, I think is good. And a lot of the things that you mentioned too, that's interesting is I looked up a couple of how to pick your doctor things. One of them's from United Healthcare. They're like, one of the biggest payers in the country. And so they have a nice little thing. I think I said before, it implies it's primary care, but the things are pretty vague about what you can do, and they probably apply to most. And then there's like another one from the government about how to pick your doctor. And you've mentioned a lot of things. So like asking recommendations. I think you guys both talked a lot about networking in the second opinion episode, getting info from other patients on who they recommend, whether it's a center or a doctor. But another thing, there's two other components that were discussed thoroughly. We'll try to get them in, squeeze them in. One is the quality of your doctor by some metric, like are they rated in some way? The other is the quality of the center by experience. And so, for example, the UHC page tells you to make a cold call to the office, and they kind of imply that if the secretary or the scheduler is rude to you, that's a red flag, and you should go to a place where people are friendly and nice and explain why it might take time to get in or stuff like that. But just evaluating the center. And I would tell you that if you look at patient satisfaction data, this is a huge factor. And people, if it's a giant center that it's hard to park at or navigate versus a little community center with a free parking lot, 5 doctors versus 50 doctors, like this kind of stuff really polarizes people in what they want. And I think it's an important thing to think about.
Yeah, I definitely agree on like I think it's important to like some of my care has been much easier to coordinate and care, and it's like a very big quality of life difference for me. And that really actually does matter to me. And so I think the level at what that matters, I think depends on every individual patient and kind of what fits best in their life.
Yeah, and one thing I just want to add, because I was thinking about this today. I was thinking all the way back to when I was first diagnosed and how, again, I was recommended I go see a certain physician. And the my surgeon was the one who told me who to go see. And she said, you want to see him because he's arguably one of the best sarcoma physicians in the country. And I took that as like, okay, done. But today I was thinking back and I'm like, well, what did she mean the best? Like the best what? The best bedside manner? The best access to clinical trials? The best what? I don't know. I just heard he's one of the best. You need to go see him. And in my mind, I translated that to he he's best at giving patients a great outcome. But I don't know that that's necessarily what she meant, right? I don't know what she meant because I didn't ask. I just heard best and was like, okay, my decision's done. Like, why would anyone pick anyone but the best?
But
And you're right. Like when I was thinking about where to go, when I was newly diagnosed, thinking about where to go for second opinions, I was Googling, I was looking at rankings, and if they're ranked high, it must mean they're good at something. And I think that there's probably some demystifying that could happen there.
I think
Yeah.
I was just gonna say, I think it'd be interesting, Julie, now that like you are more involved and like we're both kind of more involved in the space and kind of know more experts, quote unquote, in the space. Like when I think of some of the people that I think of, like if I was in a scenario, they would be my go-to. I can't see any organization that would rank them and put them in the list and the ranking that I have. Like I don't know who would create that list. And if it did, it wouldn't exist on the internet somewhere. Like I
Well,
just
yeah.
can't see that happening.
Yes. And when I think about the people that I would go see, if I had a really tricky lung tumor to remove, I know who I'd go see. I have absolutely no idea what ranking his center has.
Yeah.
If I really felt like I wanted to get the best immunotherapy option, I know who I would go see. I don't even know what center this person is at. I can't even tell you. I just know the name of the physician. So I feel like now I operate very differently than I did before because now I would go for a person, not a center, nothing else. And I would go for these people because of the reputation they have among hard to treat patients. In stories that I've heard from specific patients about how they were willing to take a heart surgery when no one else would, or they were willing to think about this treatment when no one else would. And that's just really different than how I approached it when I was newly diagnosed.
Yeah, we can actually fill in a little bit of details to give some info to the issues that you were both talking about, which by the way, like if I was a like a hospital marketing person, this would like be so fascinating to me, but also would drive me nuts because it's such a hard problem to solve. And I would again refer back to our second opinion episode. It was Katie, you do a really good job of explaining that this is a marketing thing when you're Googling, right? So there are different ways that you can be ranked or whatever, or like things like that. But if you're just Googling, it's very likely that that center has done the same that other companies do to like kind of land at the top of the list for at least the region that you're in or where you're sitting. But a couple of things that are pointed out that are worth mentioning. So you both mentioned the best and you implied like some kind of technical expertise. And so there is a system in our country where people are, the term we use is certified by boards, right? And so in oncology, we're talking about either a surgical board. So like Julie, you just mentioned a thoracic surgeon. They have their own board that certifies people. Radiation oncology does, medical oncology does as well. And so this is where you hear about your doctor like getting trained and then taking tests and then becoming certified. And that board is saying that their knowledge, here's what mine actually says. I pulled this out into our outline. My board says that their mission is to certify that our diplomats, that would be me, diplomat, demonstrate the requisite knowledge, skill, and understanding of their discipline to benefit of patients. So like that's super vague, but it's like basically saying that I'm knowledgeable enough to treat a person and not screw up their care, at least per current standards. And then there is like a big debate happening in the medical world about like continuing education once you're certified. Like, do you need to keep training and keep studying and stuff like that to stay up to date? Probably outside of the scope of the show, but it's just a debate that's happening. But realize that hospitals do this too. And then there's accreditation programs, which I do think have some value. And I'd actually point out that they have variable value, but like Julie, you mentioned a lung surgery. So that happens by what's called a thoracic surgeon. And they are, in my opinion, the national leaders and who do the best job of trying to help you answer the question, is my surgeon the best surgeon or a good surgeon? With what most people think, like, is the outcome good? And they do a really good job of giving patient-facing information about that. So that's just they do a great job, and it's the best example. I can kind of link their patient page so people can look into their credentialing and database stuff if that makes sense. The only other one thing I really wanted to quickly say is you both have mentioned this a few times. One of the advantages of the big name places is they're going to have super hyper specialists. So if you are a patient with a very, very rare cancer, like both of you, there's probably an inherent benefit going to a place that has a dedicated program for sarcoma, for example, like in Julie's case. That would probably at least give you the idea that like the experience level of your doctor at that center is going to be higher relative to someone who treats everything out in the community, just because that's all they do all day is just see that. And so that's probably worth saying, I think.
There's so much that I want to say still, but we'll have to
I know, me too.
I think I think to do another episode on that, like continuing education. I think there's a lot we can like talk on another podcast about that. That'd be an interesting topic to dive further into some of these things. Because I think there's also like levels of like physician scientists, for example, who might only have one day in clinic, like they see a different level of patients and stuff like that too. So all things to like take into consideration that maybe we can do in a part 2 episode.
Yeah, and I know we're like running out of time. I had some stuff about like the doctor's personality because you brought that up as well. It's kind of just like subjective. I think I hear from patients a lot that paternalism is an issue. So I know some patients seem to value like someone that will explain things to them and answer all their questions. And actually, both the government and UHC wants you to ask questions and make sure that they are answered. That's like an important thing they say to point out. But that varies among doctors. I guess that's probably too big of a topic to talk about in a couple of minutes. So
Yeah, I think we should add that to it. I think we should maybe do a part 2 of this and add that because I do think that that is a like that's not my top ranking, but personality like goes a long way.
yeah.
And I think there's a bunch of nuances, and I think it does affect quality of life and stuff like that. So I think like maybe talking about the like in the you've got everything else. Now let's start looking at the second thing you look for, and like those all fall into those categories for me.
Final thoughts from Julie or Katie anymore?
I'm glad we did this one.
Yeah.
I don't know if I have any final thoughts on like the best place for a patient to start to figure out where to look for these things. I think if any of you or if either of you have any concrete advice to give patients a starting point for any of that, I think that would be great value add for us to add. But if I don't have any, I don't know if either.
I mean, I think for me, I think this is a hard topic. And I think you nailed it at the beginning when you said people have to make these decisions when they have the least amount of information. Um, and so, the only way I know around that is for people to get connected to another patient or a private navigator of some sort who can jumpstart them in the right direction. Like that, I always tell people, like, try to get connected to a patient organization of some sort who can fill in some of these gaps until you're ready, until you're more knowledgeable.
That's great advice.
That is really good advice. And I want to think about this more and come back to it and talk about it again.
All right. Should we wrap up there then?
Yeah.
All right.
See you later.
All right, bye.